Your blood pressure reading is perfect. You check it every morning. You see the numbers appear on the screen, and you feel that rush of relief. You tell yourself that the medication is working, that your doctor is happy, and that your heart is safely tucked away from the dangers of hypertension. But what if I told you that those numbers are lying to you? What if the most dangerous damage currently happening inside your body is invisible to your blood pressure cuff and completely ignored by your standard checkups? There is a silent thief stealing your longevity right now, even while you think you have everything under control. Today, I am going to reveal the hidden process that keeps progressing long after your pressure is managed. And if we do not address this specific mechanism, you might be walking toward a cliff while looking at a green light. Before we dive into the secret, if you want to stay ahead of these medical blind spots, please pause for a second, hit the like button, and subscribe to the channel so you never miss these vital updates. The information I am sharing today is for those of you who want more than just survival. You want actual, vibrant health. Tell me in the comments below, what is the one habit you struggle with the most when trying to keep your cardiovascular system in check? Let us get into the reality of what is happening under your skin. My name is Dr. Harrison Blake, and for the past 15 years, I have dedicated my career to investigating the intersection of metabolic health and longevity. I have seen thousands of patients who follow the rules, take their pills, and eat their greens, yet they still experience the terrifying symptoms of vascular decline. My goal is simple. I want to bridge the gap between complex medical science and your daily life, giving you the tools to stop playing defense and start building a resilient body. When you think of blood pressure, you likely think of the force against your arterial walls, like water rushing through a garden hose. You take a pill to lower the pressure, and you assume the hose is safe. However, the hose is not just a tube. It is a living, breathing organ. Your arteries are lined with a delicate, slippery layer called the endothelium. When this layer is compromised, it does not matter if your blood pressure reading is a perfect 120/80. The damage is occurring on a microscopic level, triggered by factors that your doctor barely mentions during a 10-minute consultation. Let us look at the real enemy, oxidative stress and chronic low-grade inflammation. Even if your medication is keeping your heart from overworking, if your bloodstream is filled with oxidized particles, those particles are scraping and irritating the walls of your vessels like sandpaper. This is the hidden damage I am talking about. It is a formation of microtears in the endothelium, which signals the body to start a repair process that eventually leads to plaque buildup. This is why you cannot control blood pressure and still experience cardiovascular incidents. The pressure is low, but the environment inside the vessel is toxic. Most people focus entirely on the systolic reading, but they completely ignore the quality of the blood itself. If your HDL cholesterol is low, you are losing your primary cleanup crew. HDL is not just a number on a lab report. It is an active scavenger that goes into those arterial walls and removes the debris that causes blockages. If your HDL is low, the cleanup crew is missing and the trash piles up. Now, why does this happen even after you turn 40? Because your metabolic efficiency begins to shift. As we age, our bodies become less adept at handling glucose spikes and oxidative stress. Many of you are sitting on a time bomb of insulin resistance without even knowing it. Insulin resistance is the silent driver of arterial stiffness. When your insulin levels are constantly elevated because of excess refined carbohydrates or a sedentary lifestyle, your vessels lose their ability to dilate and contract naturally. They become rigid. Imagine a stiff, brittle pipe versus a flexible, rubber one. When a surge of pressure hits a rigid pipe, it cracks. When it hits a flexible one, it expands and absorbs the shock. Most longevity-focused patients are so obsessed with cholesterol numbers that they forget to ask about arterial elasticity. You can have perfect cholesterol, but if your vessels are stiff, you are still at risk. Let us talk about the role of triglycerides. Triglycerides are essentially the fat particles floating in your blood, waiting to be used for energy. When you have high triglycerides, you are essentially causing a traffic jam in your cardiovascular system. These fats interfere with the delicate chemical signaling that keeps your vessels healthy. If you have been living on a diet of processed snacks or sugar-laden drinks, your triglycerides are likely high, which means your arteries are being bathed in fat that is prone to oxidation. Many of my patients tell me they feel tired by 3 in the afternoon. They blame it on work or lack of sleep, but often that fatigue is a direct result of poor metabolic health. Your cells are not getting the fuel they need because your circulation is sluggish. You are not just tired. You are being starved on a cellular level. To truly protect your heart after 50, you have to change your strategy. It is not just about the medication. It is about the environment you create for your cells every single day. The first step is to focus on what I call the vascular integrity protocol. This starts with movement, but not the kind that leaves you drained. We need to focus on zone 2 training, steady, rhythmic activity that gets your heart rate up just enough to encourage the production of nitric oxide. Nitric oxide is the miracle molecule that keeps your arteries relaxed and flexible. Without it, your vessels are essentially screaming for help. You can stimulate nitric oxide production by simply incorporating leafy greens and beets into your diet, which are precursors to this vital gas. Another major fix is regarding your intake of omega-3 fatty acids. Most of the modern world operates on a massive imbalance of omega-6 to omega-3 fats. Omega-6 fats are highly inflammatory, while omega-3 fats are anti-inflammatory. If you are eating processed vegetable oils and avoiding fatty fish, your blood is essentially a soup of inflammation. That inflammation is what leads to the hidden damage I warned about. It is not enough to just take a pill to lower your blood pressure. You have to stop the fire from burning in the first place. You need to switch to olive oil, increase your intake of wild-caught salmon, and cut out the seed oils that are so prevalent in the modern diet. Let us address the curiosity that most people have about supplemental support. People always ask me if they should be taking high-dose supplements to fix these issues. My answer is always the same. You cannot supplement your way out of a poor foundation. Before you look for a magic pill, you must optimize your sleep. Sleep is when your body repairs the endothelium. If you are only getting 5 or 6 hours of sleep, your vascular system is never getting a chance to reset. The inflammation markers in your blood will remain elevated, and no amount of medication will compensate for the lack of deep restorative rest. I want you to think about your health as a long-term investment. If you ignore the foundation, the house collapses no matter how much paint you put on the walls. Your blood pressure medication is the paint. Your lifestyle, the diet, the movement, the stress management, that is the foundation. And if you're still feeling that unexplained fatigue, it is time to look at your fasting insulin levels. If your fasting insulin is high, your body is effectively locked in a state of fat storage and inflammation. This is the single biggest indicator of future cardiovascular risk that most people never get tested for. Go to your doctor and ask for a fasting insulin test. If it is over 5, you have work to do. Many of you are living with a false sense of security because your doctor says your numbers are within range. But range is not the same as optimal. Optimal is where you have energy, mental clarity, and resilience. If you are 40, 50, or 60, you can turn this around. The body has an incredible capacity to heal if you give it the right environment. Stop focusing on the single digit of your blood pressure and start focusing on the factors that drive the health of your entire vascular system. It is about the quality of the life you live, not just a number on the cuff. We have covered a lot today, from the dangers of arterial stiffness to the necessity of nitric oxide and the importance of insulin regulation. It is a lot to process, but the path forward is clear. You need to shift your attention from the temporary control of symptoms to the permanent improvement of your systemic health. Your body is smart and it is capable of healing, but you have to stop feeding the inflammation. You have to start valuing the repair process as much as you value the medication you take. I want to thank you for sticking with me through this deep dive. If you found this information valuable, please make sure you're subscribed, as we will be exploring more on how to specifically reverse insulin resistance in the next few weeks. Share this video with a friend or family member who you know is worried about their blood pressure, because they deserve to know the truth about the hidden damage. Leave a comment below telling me one change you're going to commit to this week to improve your vascular health. Remember, 15 years of practice have taught me that the smallest changes often yield the biggest results. You have the power to change your trajectory today. Do not wait for the next checkup to decide that your health matters. Take control, stay curious, and keep striving for that version of yourself that is full of energy and vitality. Your future self will thank you for the decisions you make right now. You are not just a collection of test results. You are a complex system that needs care, attention, and a proactive approach. Thank you for watching, and I will see you in the next video where we continue this journey toward optimal longevity and true health.